Hi everyone, welcome to week 5 of your Pharmacy Careers 2 course. This particular week we are covering Chapter 9, and Chapter 9 is all about mail order pharmacy. When I think of mail order pharmacy, living in the St. Louis area, my mind automatically goes to Express Scripts. So if you're familiar with Express Scripts, it's a type of mail order pharmacy. Mail order pharmacy is intended to dispense medications that patients take for chronic conditions. So these would be things like blood pressure medications, medications for diabetes maintenance, that type of thing. The idea is that a mail order pharmacy does not compete with the retail setting for those urgent types of medications. So, for example, you take your child to the doctor and they prescribe an antibiotic. You're not going to have mail order pharmacy fill that for you. Instead, you're going to go to your local store. So that's one difference between mail order and retail. They have a very high volume when we talk about a mail order pharmacy, as far as how many scripts they process on a daily basis. Now, most employers do offer some sort of benefit that includes mail order pharmacy. And the reason for that is because there is a lot of cost savings that they can realize. In addition, there's obviously the convenience of having things delivered straight to your home. There are a lot of efficiencies associated with mail order pharmacies as well. Now, of course, there are some disadvantages. There is very little personal contact. There is medication waste, and by that we mean, let's say, for example, your doctor put you on a medication, and you got a 3-month supply, but a few weeks down the road you find out maybe you're allergic to it or something like that, and you go off of that medication. Well, that meant you have all of that. You can't return that, so that is a disadvantage. Also, time delays. You may not, if you don't remember to order a refill, you might not get it in time if you're, running close on time. Some of the things that you might find in a mail order pharmacy, some of the different things that you're going to be looking at, include the different types of personnel. So in a mail order pharmacy, just like in any other type of pharmacy, you are going to have pharmacists. They are there to do screening, checking. They also do consulting. And they actually will communicate with patients if needed. Obviously, it's a little different type of communication. Usually it's by phone, but they do have that consulting type of role. As far as pharmacy technicians, they're going to fill several different roles within a mail order pharmacy. They might be actually doing order entry. They are going to actually enter things into the computer. A filling tech is going to actually process the prescription order. And then we have the support tech, which are going to make phone calls on behalf of the pharmacist. We also have folks that are going to be opening up actual mail to retrieve the prescriptions and send them on down the line to the techs to enter them. There's going to be all kinds of personnel involved with billing, adjudication, patient billing, that type of thing. Obviously, folks for packing and shipping. And then we have the customer service folks available as well. The inventory within a mail order pharmacy is a little bit different than a traditional retail, because obviously they are not going to be carrying everything that you would carry in a retail pharmacy. Like we said before, it's mainly the maintenance drugs. You're not going to see those drugs used on a daily basis. And they are going to be more likely to carry some of those infrequently used, more expensive and hard to find medications. If you've ever been to one of these and looked at them, they do look a lot more like a warehouse. There is a lot of technical stuff, technology as far as movement from one part of the pharmacy to another. I actually took a tour of the Express Scripts in St. Louis, and it's huge. I mean, it's absolutely huge. But they do still have some of the same types of work areas that you would have in a regular pharmacy. You're still going to have folks that are going to be doing, some things hands-on, like you do in a regular retail pharmacy. There are some specific things in a retail pharmacy or in a mail order pharmacy that are different from retail. Obviously, things like shipping and receiving and things like that. So, as you go through this particular week and you look at all of the interesting aspects of mail order pharmacy, if you have any questions, please make sure that you reach out to me and have a great week.